and welcome to another very exciting episode of TeqTalk, where we discuss data, AI, and innovations. I'm your host, Jazz Kaur, and today we have a very fascinating discussion lined up with Alex Waddell, the Chief Information Officer at Adobe Population Health. Thank you so much, Alex, for joining the podcast.
Thank you for having me. I'm really excited.
Yeah. So, Alex, your journey is really inspiring. So, from being a Salesforce application architect to now a digital transformation leader, the CIO at Adobe Population Health. So, let's start by giving our listeners a glimpse of what Adobe Population Health does and a little bit about your journey as well and the vision of your organization.
Definitely, yeah. Hello, everybody. My name is Alex Waddell. I'm the Chief Information Officer at Adobe Population Health. At Adobe Population Health, we partner with Medicare and Medicaid plans to provide complex case management support to our members. What this means is that we're kind of advocates for the member. So we help support them when they go into the hospital, help them transition back home. We help them understand why they got there and maybe any new medications that they were given. And then we help them coordinate with their doctors and with the plans to ensure that they are, communicating with the outside networks, that they're continuing to have the support beyond what Adobe does. We also do what are called preventative screenings. These are, cancer screenings for members. These are, diabetic management, blood pressure management, the things that we can really control and things that we can keep an eye on. And again, that just helps people manage their diseases or manage anything that might pop up. And we also support the plans in collecting key data that help them direct benefits towards the member. So if we find that somebody's diabetic and nobody else has ever found that information, then the plan gets that data from us, and then they change the benefits that the member's on to help support them in that. So again, we are really here to support the member. We're advocates for the member, but we partner with the plans ultimately to reduce cost. And the way that we do that is by keeping people out of the hospital, by keeping them healthy, keeping them in their homes, within their communities, and support those things that are just preventable. We help prevent, things that are preventable. How I started and got into Salesforce is kind of interesting. Is I didn't go to school for technology. I never really coded or anything as a kid. Oh, yeah. And I never really liked computers, or anything like that. I mean, I played computer games, but I never saw myself in an IT role. But I wasn't having a lot of luck out of college finding jobs or finding work that was really inspiring to me. And I actually was over at a family friend's house for 4th of July, and it was a very nice house. And, we're watching the fireworks, and I'm going, how did this guy get this, And my wife said, well, go ask Michael, if he'll have lunch with you and maybe he can talk to you. And, so I went up and I asked him, I said, hey, are you willing to do lunch? I'd love to pick your brain a little bit. And he said, I can do breakfast. And so, I met him for breakfast, and he asked me, would you ever think about doing IT? And I'm like, computers, no way, I'd never do that. And he's like, okay, how about software development? And I'm like, I don't like to code. That's too much for me. I'm not smart enough for that. And he's like, okay, how about data analyst? And so, he explained to me what a data analyst was. And I said, okay, that sounds cool. Thank you. Have a good day. Little did I know that was my interview. And he was actually interviewing me because he was spinning up a Salesforce org for his organization. And so he invited me to come on as an intern for 6 months to try out Salesforce administration with the goal of getting a certification at the end of the 6 months. And, from there, I picked up on the platform and I've been running with it. The company that I was working with him eventually got bought out by our current CEO, Jamie Ambrose, and she now owns Adobe. And I stayed with Adobe to continue building their system in Salesforce.
Yeah, that's pretty inspiring. I mean, I've known you from last a couple of years, but this story, even it's new to me. So
Thank
yeah, and
Well,
that's
I love to share it because the thing I love about, Salesforce and
Mhm.
technology is that, not only are we transforming organizations, but we can transform individuals as well.
You're-
You take somebody who's never had any experience and teach them these tools, and they can really have an impact in an organization or for us at Adobe Population Health in people's lives. So, it's really an incredible journey that we've been on.
Yeah, I mean, that's really impactful as well. So what do you see? What is the vision overall for Adobe Population Health? What are your goals and vision?
Yeah. Yeah, well, so our mission is to positively impact the lives we touch. And, then that goes for everybody, our payers, our staff, and ultimately the members. When we first started out on this journey, our vision from a technology standpoint was to, overcome many of the challenges that are in the healthcare space. Being like interoperability, things like, EMRs are just usually, they do like one thing really well and then they don't do really anything else that you need. And so, my mentor at the time, and who's the owner of the company, said, well, why don't we build our own system and then we get all of these benefits of reporting and automation and, in the future, AI and having integration, the possibility to integrate, starting with these foundations. So really our vision for technology is to, even as a small company, to have the best technology in the world, because we are a very fast growing company. We believe that Adobe Population Health, should be everywhere across the United States and, maybe one day even across, the globe. And because what we do has such a positive impact in people's lives. But to do that, we have to start on the best technology. We can't, get something and then have to change it out later and then run into all these issues. So, it's starting with the best technology in the world, listening to our clinicians and our end users on what challenges they're facing every day. Something that we always talk about and that I express to the organization is, we are not the experts in what you do. We make what you want a reality. So we listen very, very closely. I never go to my clinical team and say, you have to do it this way. I say, what do you need to be successful? Ultimately, what I want out of an electronic medical record is a system that stays out of the way of the good work that the clinicians are doing, right? So, an electronic medical record doesn't necessarily solve the problem for the member in the day to day, right? We're collecting data, and sure, Adobe needs the data to run analytics and AI, and the plans want the data to be able to report back to the government agencies that want to know how many people have this or that. But the person that we're sitting in front of is facing a challenge. They just got out of the hospital. They just got diagnosed with a new chronic condition and they're afraid, they might not have resources. How do I build a system and utilize technologies like we're likely going to talk about soon to get the system out of the way so that they can focus on solving the problems in the home, educating them on something that, on their new diagnosis, or ensuring that their medications don't interact. That's really my vision for technology, and it serves our mission at Adobe Population Health.
Of course. I mean, that's really fascinating to see that you, as a leader of the company, is focused a lot on better care management, right? People, be it in the clinician department or from the care side, you focus more on people. That's very, very fascinating to see. And we all know that this healthcare industry is so sensitive and it has got its own unique complexities, right? Like how you mentioned that data silos, data are there in different areas, might not be sufficient to just get data from one section. You have to get data from different places as well. And my next question would be, other than these things, what are a couple of more challenges you see?
Yeah, I mean, so, just to, highlight them maybe a little bit more deeply, to be honest, the issue with healthcare is we're falling behind because of, it's not just interoperability or data silos. It's like we don't have a standardized language that we speak. There are some like fire standards and HL7, EDI, but the doctor down the street from me doesn't necessarily speak the same language as me. Our systems are not set up, we're not integrated, we're not talking to each other. So this is a huge problem because information is key, right? If I find in a portal somewhere in a doctor's EMR or maybe a government portal, a key piece of information that's going to change that person, the decision that the clinician makes in the moment, that could change a person's life for the better. That could keep them out of the hospital. That could keep them at home longer and with their families. So, but the problem is all this data is just out there sitting on paper documents, on PDF documents, so reporting is huge. Integration is such a big problem. One thing that I'd write down here, just kind of in my notes beforehand, we're still faxing, like, and it's not going anywhere. So, when our industry really needs to come up with creative ways to bridge these gaps, because the doctor in Nogales, which is a border town here in Arizona, doesn't have the means to elevate their technology to where I need it to be. So I need to figure out ways to meet them where they're at. And, my organization benefits from using a single Salesforce platform for our electronic medical record in all of our processes. But not every organization started 8 years ago on Salesforce.
Yeah. Do you think you are still ahead of the game? You're still adapting the AI and technology stuff, because a lot of organizations, they are still not sure what to do. They are still having all the legacy systems, traditional methods. They are still, everything was on paper. So what is your current state? Do you think you are, or maybe the use cases are defined in a much better way and the vision is very clear?
Yeah. I think that we're postured really, really well, and I think that we see that in our ability to adopt new technologies very quickly, right? So, for example, like you said, artificial intelligence. Most organizations in our industry in healthcare have to actually deal with the aggregation of all the information in the cleanup, right? I worked for an organization out of Texas, and they were in 7 different states, and they had 7 different systems, right? Every time they went into a new state, they got a new system. And that's normal in healthcare because,
Yeah.
you go find a state specific solution that's going to meet the needs of that plan or of that state regulation. But then you have this issue of, well, if I want to elevate my technology to the next level, I have to do something to bring it in. And, Data Cloud is something that Salesforce and MuleSoft are trying to use as that, GUI, I guess, as a technology to merge that. But, Adobe Population Health has been very fortunate that we just started on a single platform and built on top of that platform. So when I want to, do something, for example, like Prompt Builder, I can just turn it on. I can just go, and having, for us, an in-house development team, an in-house integration and analytics team is super, super important for us. I talk to leaders all the time and we have these conversations about, consult versus not. I'm more of the strategy of, let's use consultants when we need to get over that hump of that really critical stuff. But I should be doing a lot of the core platform development myself because I understand what I need. And, that really allows us to be agile and use consultants such as Tech Focus in key areas where we just don't have the skill set. So, starting at with the Salesforce platform, in-house development was really, really huge for us because we don't make the mistakes that a lot of companies make where you go to a consultant, you explain to them what you want done, and they build it. They built it the way you asked for it, but you actually didn't ask for it, right? Because you don't even speak the same language. So, yes, I think that we're postured really well, and we're very fortunate in that sense. But we still run into challenges even within our own org, in our own Salesforce org, of data being kind of all over the place, and you run into limits on the amount of fields in an object, and you run out of, you hit limits on relationships, and now you got to build a whole separate system for a new department. Well, that's a silo within a single house, right? I made a room and then I locked the door, right? So, we're still facing some of those challenges, but we've really lucked out in our ability, the fact that we started with the Salesforce platform and built from there.
Yeah, and I think it's very inspiring to see these tools are not only resolving the current issues or challenges, but they are very open for the innovations, like how you mentioned that if you're thinking of prompt builder or something, you just enable it and you just started looking into it and see that, oh, yeah, this is good. I can use it for further purposes. And another thing which I really liked about you is what you mentioned, that how you do hands on yourself first, and then you have the capability and interest, I would say, right? Being at the leadership position as well, if you're doing the groundwork to see if it is going to work or not. So I think we need leaders like this who show the interest toward technology and really understand technology,
Yep.
right? So
Yep.
now
Yeah,
let's,
not just at a high level. Oh, I understand what Salesforce
yeah,
does and I signed the contract. It's like,
right.
no, I actually like go on a whiteboard and architect out the system with my team, and that really allows us to avoid, mistakes or, technical debt in the sense of building it wrong. And again, bringing in the stakeholders, having a culture, one thing that we really have here at Adobe is like a culture of innovation and a culture of accepting technology and change. So when I go to my teams and I say, "Hey, I've got this really cool opportunity with Prompt Builder,"
Hmm.
my nurses are not freaked out about it. Now they might have concerns, but they're like, "Yeah, that sounds amazing," because we go to them, we say, "I'm gonna solve a problem for you if you just work with me and adopt this technology, and we'll work together, and I won't roll it out until you believe in it," right? And so that really goes a long way to foster a culture of innovation and change, especially at a company like Adobe that grows so fast. In the early years, we were doubling in size every single year. Now it's not, we're bigger, so it's not doubling, but, we were Inc. 5000 fastest growing companies 2 years in a row. It looks like year 3 will probably be there as well. And you don't get that by having, thank you. You don't get that by having rigid systems and by not, you have it by using the best, being flexible, being creative, and having the people in house to support that. And then, like I said, using partners to come in and say, hey, we've got this really hard challenge. Maybe it requires a lot of code or a really complex integration. Let's bring in an expert and use them in a niche capacity. So my chief financial officer isn't, on my back going, hey, you're spending $200,000. So what's going on? I say, hey, here's a very tight knit project. Let's get it done. And everyone's on board from the top all the way down. So I'm so blessed to work at an organization like Adobe Population Health, have such a great team on the IT and the clinical side and the operations side. It
Yeah.
really is a blessing.
So you mentioned somewhere that you enable Prompt Builder. So would you like to tell more interesting stuff about Prompt Builder and what led you enable that Prompt Builder? You had some use cases in the mind?
Yeah, absolutely. So when I first saw a prompt builder, I was super excited about it. Everyone's used ChatGPT, right? We've all messed around on it. It's such interesting technology, but especially in healthcare, we know you can't actually put PHI into ChatGPT. So when Salesforce came out with the solution, I was like, that's awesome. The second thing that I really like about it is it's a declarative solution, right? Or at least it's a writing out solution. So you don't have to code, which is amazing, right? So for somebody like me who's not a coder, for my team out there who are learning every single day, having something that you can talk to and work declaratively was a huge win for us.
Mhm.
The way that I thought immediately about generative AI as a solution to a healthcare problem is that, we have our staff filling out these very large assessments, right? They go into the home and they have to fill out 100 questions, right? And the way our system's set up is they're all drop downs. Are you diabetic? Yes or no? Do you smoke? Yes or no? But as an industry and, for us to pass audits and to be in compliance, the clinical staff still needs to write a note at the end of the assessment, right? So
Right.
basically they're filling out all these drop downs for 30 minutes with the member, and then they have to write a paper on what they just talked about and just answered above. So immediately I thought, okay, well, if they said yes up here to member smokes 3 packs a day or something,
Mhm.
but then they have to come down to the bottom and remember that or go, and then type out member states they smoke 3 packs a day. Why not use a generative AI tool to simplify that process, to aggregate that information and maybe information across the account and across the chart that is pertinent to that visit so that my staff doesn't have to remember everything and type everything out, but they're now a prompt comes up and it summarizes it, and all they have to do is review the prompt, make their changes, and commit it to the system. Now, what does that do ultimately? Yeah, that saves me time, right? That saves our staff time. Now they can spend that time educating the member on something, supporting them on that, getting that next visit scheduled, getting them to, some food or whatever it is that they do, because the complaint that I would get from my staff is these assessments are so long, I can't actually care for the member. I'm just filling out all the stuff you required me to fill out, and they are required, so you can't save it without filling out the question. So for me, it was really, again, like I talked about earlier, it's getting the system out of the way so that they can do what actually has an impact in people's lives. So that was a huge win for us. We've actually implemented that, and we've
Mhm.
seen that we've been able to save about, I don't even know. So this particular process, they would spend half of their Thursday every day just writing up these essays. And all these were like, it's called a ICT or integrated care team. And basically what we have to do is we pick 10 members on their caseload and they have to write up a summary about what's happening with that member, what we've done and anything new that's changed. And then we present that to the health plan. And they would spend basically from like noon to 5 every Thursday, all the nurses would come off the phones and they would just do this job. Well, now we've cut that down from a 1 hour or no, I think about 45 minutes per chart. And they would do 10 of them a day. So 450 minutes.
Wow.
We
That's
chop
a that's a large number.
Yeah, yeah. So then we cut that down by a third, right? So instead of spending 450 minutes, they're spending 150 minutes. So they're only spending 2 hours instead of 5. They can get back on the phone. They can make that impact in a member's life. And, that was huge for our organization. And then now I want to do that for every assessment that we do. Again, if you're saying something up here that you have to write down here, why would I have you type that? That's just a waste of time. That takes away from the member. But also, the last use case that we're currently building
Mm.
is just an account summary, right? Like, all the data is in our Salesforce org in the account, right?
Yeah.
But not everyone can poke around the system and find what they need. And frankly, I'll admit it's not always clear about where the stuff is. And I'm saying I may have not designed it as well. It's grown over time, right? Tech debt exists. So if I can have them, every time they come into the account, I have a flow that refreshes my prompt, and it has a 2 paragraph just quick write up to say, hey, this is what's happening with the member. Here's what you should do when you get into the home. Like that for my team saves them time in refreshing themselves on the member. It might have been a month since we've seen them. They have to, what's called a chart deep dive to say, what did I do last time? What were the main points? Has anyone been in here since? And what's coming up in the future that I should be aware of? Why not just push that right up to the top of the account in a
Yeah.
paragraph essay that people, can digest more easily than going to like related lists and poking through, objects. I mean, that saves an immeasurable amount of time for our staff. And again, they can call that next member, spend more time with
Mm.
that person, coordinate that next visit, whatever it is. So we just want to do more with less. And it's incredible to work for an organization that allows me to try these things. And, it's not hard dollars I'm saving, right? It's opportunity cost. But to have an organization that believes in that and says, yeah, we want our staff doing more, having a greater impact, so let's adopt these technologies is really a dream come true for me.
Yeah, when I talk to most of the leaders, like I ask this question very often that how do you see the organizations those have traditional systems, right? And the leaders, even there, they are not flexible enough. So in one of the statements you mentioned that we are very flexible. You are very flexible in adopting and trying out something new or trying out any technology, right? You because you are hands on yourself and there isn't any fear of technology. But in a lot of cases, we see that the legacy systems and the traditional systems are not getting changed because of the mindset of the leaders and kind of fear they have. And any change is not comfortable, right? If you want to put change anywhere in the system, it is not comfortable. So that kind of risk taking factor they do not have. So what do you think what's happening around the healthcare industry? I know that in Adobe Pop, leaders like you, young leaders and those who have, they are very enthusiastic about the technology, right? So you are the risk takers as well. But in general, when you talk to leaders, what is your perception? Are you seeing such cases where they are not ready to, implement changes because they are
Yeah,
scared somewhere?
Yeah, I think so. I think healthcare, an issue with our industry is that the clinical demands require a lot of staff, a lot of oversight on the clinical side and on the
Mhm.
operational sides of things. So the IT teams tend to get the short end of the stick. When you're running at a 90% labor margin, which isn't terrible for some types of healthcare organizations, it doesn't leave a lot of room for, opportunity to invest in new technologies or even invest in the enough people to support a change like that. So
Yeah.
what I find is that a lot of people are stunned because they say, "Well, I don't love this legacy system I have, but it works, I guess, right? Like I can accomplish what I need to accomplish." But then they'll never get to that next step to utilize these technologies that we're talking about. I mean, a lot of
Mhm.
these EMRs don't even integrate, right? I mean, in healthcare, we're still using like CSV files a lot of the time, which is fine. Like I can make that happen, but it's not, we're not elevating to where, you're seeing in the financial tech, industries and many of these other industries that that we compare ourselves to. Yeah, I find that that a lot of leaders sometimes just have so many of these legacy systems that it's really hard to envision a pathway to like that perfect state of a single system or as little systems as possible. So then they do nothing, right? So then they
Mm.
take inaction, right? They don't actually do what needs to be done until something happens that forces their hand, and then it hurts a lot more. But then, a lot of the times it's difficult because when you have 7 systems, let's say, and you wanna bring it all in, that's a lot of coordination, a lot of
Mhm.
people to get on board, a lot of time and money spent, and the issue is you you run into the problem of like, I'll give you an example. My mom worked for Toyota Financial, and they were building a Salesforce org, right? Or they were changing their system up, and she kept telling us, "We've been working on the system for 4 years, they're spending so much money on it." By the time they rolled it out, it was out of date. So
Right.
you kinda have to do like a walk, crawl, run approach, and anytime that I came into an organization and they didn't have Salesforce, we would start with, like, a small department and just build something for them. And with the idea of going outward in the organization, but get that proof of concept done, prove that you can, go from start to finish, enrollment to billing and get it done. And then you go out into the organization and get buy in. Because if I, as a leader, came into an organization brand new and said, hey, next year we're done with all these systems, we're going in Salesforce, there'd be a mutiny on our hands, right? So I think just the strategies need to be a little different, but I feel for my contemporaries at large organizations, they have a huge challenge on their hands. I think that's really where Data Cloud and MuleSoft will come in hand, because they may not be able to actually do what I've done, right? Getting to where I'm at just might not be possible at an organization in 20 states and 20,000 employees, but maybe they can begin to use these technologies to get some of the wins that we're able to see in our organization.
Yeah, absolutely. Very well said, Alex. So, adapting technology, any new technology and AI system without any hurdle is not possible, right? When you have started with new integrations and all, probably you would have also got a lot of hurdles. So, would like to know more use cases from your side. And first of all, tell what kind of integrations you have done. We have heard of MuleSoft, Data Cloud, and all of that. I'm pretty excited to know more use cases from your side and what kind of hurdles you saw and how you were overcoming all of those.
Yeah, definitely. So, from an integration standpoint, we've used a lot of different systems in the past. We're actually this year made the commitment to go 100% into MuleSoft. And my team's doing an incredible job learning the platform. I'm really proud of them. One of the first things that we built in MuleSoft was an integration into the what are called health exchanges in the states that we're in. So I was talking about earlier that transition of care process. So the key to meeting our, SLAs or our, our requirements for that is timely notification of discharge. And, a big problem in healthcare is data cleanliness, right? The plans don't get notified of a discharge in a reasonable amount of time. And by the time we're supposed to reach out to them, we're already overdue. So what we've done is we've integrated with the health exchanges, and the health exchanges are a government entity, and they sit in between organizations like myself and the hospital systems.
Right.
And so when somebody goes into the hospital, they type in your information, they get your name down, all that stuff. And that goes into the health exchange. And then we have an integration that sends that to our system in real time. And so then we're able to react to that and proactively reach out to that member. In a pre-COVID world, we were in the hospital with the members. So we'd show up because we knew what room number they were in, and we'd go knock on room 111 and we'd say, "Hey, I'm from Adobe. We're a benefit of your insurance plan. How do we help you get home? What do you need when you get home?" All that kind of stuff. And so that's been critical for us, is getting that timely data to actually meet the requirements of the plan, but also serve our members, because, hospitalizations, they're kind of like a slippery slope or like a snowball effect. What we see in our data is that once you're about 70-ish years old and you fall and you break your hip and you go to the hospital, you're going to be back in the hospital in 6 months, and then you're going to be back in 3 months, 2, 1, and then you're on hospice, and then unfortunately, you know, you may be deceased. But what we can do is interject ourselves and say, hey, let's react to this issue. Let's figure out why you went in. Let's get you a shower chair to make sure you don't slip. Let's get you, something to help you get up the stairs. Let's get you a walker. What simple things can we do to solve your problem? So, that's a critical integration for us. We have an entire billing system made out of Salesforce, and I don't know if anybody else does that. I've built multiple billing systems in Salesforce. Their claims, it's a file type called an 837P, and it's a pretty complex file type. But the thing I love about Salesforce, and one thing that when the first time I ever got that project, my mentor gave me the 837 text file, and he said, figure out how to make it. He didn't give me any other instructions. And I'm like racking my head on this for like 2-3 weeks, right? And he comes back from his trip and he's like, "Hey, where you got?" And I said, "Nowhere, man. I'm lost." And he said, "It's just data, just data. You got to figure out how it needs to be put into Salesforce, and then we'll figure out how to make it." And, that really changed my perspective when it comes to integrations, when it comes to reporting and things like that, because yeah, in the end, we just need to answer that question. What is the output, and how do I back in a system into the input? And when it comes to like our claims, you want to talk about like impact for the organization, right? So when I came back to Adobe, because I did leave for 2 years with my mentor to go somewhere else. And when I came back to Adobe, we had one biller who would manually send these claims that I'm talking about into a system. You plug and chug them all day. And he did about, in 1 year, he submitted about 3,000 claims as a full-time biller. And at the time, that was everything, right, that we did. And so when I got there, I built a claims billing system for Adobe, and, he was repurposed to another position. We didn't get rid of him. And within 2 years, we were submitting 30,000 claims, but I had 0 billers. So, rather than 10xing my staff, I just did a technological solution. You went MuleSoft. So, that was a huge win for the organization. He was able to do something else and have an impact in the organization. And he's not sitting there doing this all day, which is huge. So, the creative and clever integrations are super important. And maybe one other use case that we had. So one example, when we first actually got introduced to MuleSoft, it was about their RPA, their robotic process automation. And that was because we were tasked by an insurance plan to complete what are called health risk assessments. So you just turned 65 and this is the first time Medicare's seen you. They want an initial assessment done on you over the phone to just kind of collect some basic information about your health and your risk, right?
Right.
And so we said, okay, we're going to start collecting this information. We'll build it into our system. How do you want the data back? Because I know you want the answer to these questions. And they said, yeah, actually, we don't have any way to integrate with you. So you're going to need to put it into our system manually. And, that just makes me go, because my options are, I don't collect it in my Salesforce and I just have them put in that system, but then I don't have the data. Or
What system was theirs, if I can ask?
yeah,
That uh, they were on Salesforce as well?
no, they weren't. It was a different system. Yeah.
Okay.
So I built it in my system, and then, so I would either say, hey, don't do it in our Salesforce. You have to go over to their system and use it, log into a portal, and, then we have to do, portal management and stuff like that. And it's a whole thing. Or you put it into both systems, and now I'm just wasting time, right? Now I'm not
Syncing and all of that.
right. And so we went to MuleSoft, and they said, actually, we've got this new product RPA. When you create this record in Salesforce, we'll open that portal up, find the member, plug and chug the data in for you, take a screenshot that it was done and put it back into your Salesforce system, and, check this box so you can report on stuff like that. And that was amazing. Yeah, it's a wonderful use case. It was a lot of fun to build. And then after about a year, they were like, actually, we do now have a way for you to integrate through an API, and we would love you to do that, because the portal they were using was losing information. So even though I had proof I submitted it, they lost it. It was like getting wiped. I don't know how it happened. They had no explanation for me. So when we heard there was an API, it was like, yes, let's pivot. And we were able to spin that up really quickly. And so, the thing I love about MuleSoft is we're able to meet the plans where they are, right? If you want it entered into your system manually, I've got a solution for that. If you want a CSV file, I've got a solution for that. If you want an API, I've got a solution for that too. And so, and then having Salesforce, the platform before MuleSoft, makes it so that I can just look at what I need to output and what the transaction looks like, and I can build a system that meets those requirements. So, it's, again, I'm so blessed with the technology that I have.
Yeah,
Really.
yeah, very interesting use cases you have mentioned, and it seems that you are a great Salesforce fan as well. You have been using a lot of different products of Salesforce. So other than Salesforce, what all technology stack currently you are focusing and envisioning on?
Yeah. So, I'm kind of, I want in my organization as few systems as possible, right? And so we're in Office 365 or Microsoft partner. So we're really starting to look at how do we utilize our Microsoft suite more deeply. What we found as an organization is, okay, we were using Microsoft for like SharePoint, file sharing, and for email, and not really much else. And then we were going out and buying solutions that are native to, Office and Microsoft and what we have. So for example, Planner, right, is a project management tool, but we were paying for a different solution. And then I'm sitting here going, what the heck? Why don't I utilize that? So that's a big one. And we also have another, solution that helps us, and it's kind of like Flow, but for data. That's why I really like it. So sometimes it's, going into MuleSoft is a little bit overkill for us. So we've got this other solution that helps us kind of, hey, we got a big batch file of 100,000 members and it's in a Excel spreadsheet. This helps us process it. And then it really works really well with Salesforce. and it allows us to like create the records we need. And imagine like data loader, but like on steroids. Like it's a really, really cool tool. Really, we use Salesforce for about 90% of what we do.
Mhm.
We do have some other systems out there, like for accounting, like Sage, and for HR ADP. And really, our strategy there is how do I integrate more deeply with those systems? How do I, for example, with ADP, when we onboard a new staff member and we know their role, I can
Yep.
provision them access into Office 365 and
Mhm.
Salesforce and get their equipment purchased and get it mailed out. So, we're kind of, going to these two major systems. Anything that's outside, we want to integrate with and then, really maximize our automation potential so that I can stay very agile. I want to be able to continue to purchase cool and interesting new technology and not have to say, yeah, but I had to spend, the money over here to buy this other system or, this thing that doesn't integrate. I want to, or hire a person to manage something. It's like, let's, no, let's stay lean. Let's keep our budget under control so that I can go and do, predictions. I can go and, do AI, agent force chatbots and things that are like looking super, super cool. So yeah, that's kind of, but I may be a little boring because I swear 90% of our business is on Salesforce.
Yeah, I mean, you're not boring at all, but as one of your statements, you're saying that we would like to have fewer technologies because this is how you are cutting the complexity, right? If you are having Salesforce, you try to see overall Salesforce stack, what all it can provide instead of going to the other hyperscaler or anybody else. So I think that's again a very key point which all the leaders should keep in mind, that explore the technology, explore and see what all a product provides, and probably just one product can suffice and
Yeah,
can help
absolutely.
you. Yeah. So, I mean, again, very good use cases you have provided, Alex. And one thing which I wanted to talk regarding healthcare industry, which is like fully compliant based, right? So, how do you measure the compliance and how do you make sure the data is at top, right? You are considering data at most important part of your this AI journey. So, data privacy, data security, all of that stuff. So, would you like to talk a little bit?
Yeah, yeah, absolutely. I mean, it's a huge, kind of question mark. I think all industries are kind of nervous a little bit about unleashing AI, right? And is my data in a state to give me, quality outputs? Is it really secure when it leaves my org? Those types of things. And in healthcare, it's no different. But the thing that we have in healthcare that maybe other industries may not have as much of is that not only is there the regulatory things that HIPAA and CMS and those things that we're compliant to, but, these are members, this is somebody's life, right? This is somebody's health.
Right.
And we need to make sure that when we spin up, AI solutions that
Mhm.
we are doing it with the member first as a mentality, right? Like we're taking care of them, right? And we're taking care of their data and that we trust that what is being given to us, whether that be a suggestion
Mhm.
or some kind of risk analysis is actually accurate. Because if I use an AI solution and it tells me something wrong, or let's say for prompt, if it writes down something wrong, that could put us in an issue with compliance. That could make the clinician make a bad decision, and that bad decision could be catastrophic to the member. So when I met with my clinical teams and our quality and compliance officer, they said, "Hey, we love this technology. Like we're really interested in the time savings and the data insights that you can give us, but we really want to make sure that we can trust what you guys are putting in there."
Right.
And so, one thing, and the compliance officer, of course, was saying, is this even HIPAA compliant, right? So,
Mhm.
beautiful thing about using Einstein and is that they have the trust layer, right? I can
Yeah.
trust that my data is not leaving my organization, and if it is going outside of the trust layer, it's being scrambled, right? So that, because it doesn't need to know that it's Alex Waddell, it could be John Smith as a name, right? And you just DPHI'd it. So that's super important, and having that from Salesforce through their solutions just kind of native, like
Mhm.
completely solves the problem. Like we went through an audit recently. We were talking about AI and I just explained to them exactly what I just said. And they're like, cool, that sounds great. Here, send them a piece of documentation and perfectly fine. And audits make me nervous. They make me sweat.
Alex, as a CIO, you are literally at the forefront of driving innovations, right? You're pretty hands on and forefront on all the technologies. You are aware of what's happening, what's not in the market. So, how do you envision healthcare organizations to be in next 5 to 10 years? What kind of massive developments you're expecting?
Yeah, I think one thing that I've noticed just kind of out at conferences and speaking with my contemporaries is that they are beginning to understand that they have to make a change. One thing that I notice, let's say when I'm at like a Dreamforce or something, is healthcare is now at the forefront. I mean, their marketing is really heavily directed towards them because we really need to do something. I hope that people are seeing and I think that we'll see a shift into kind of like what you said, these hyperscalers, these data, unifying platforms like Data Cloud or Snowflake or something else. People need to find a pathway to get their data into a place where they can start adopting these technologies and allow that to trickle down into the broader communities. Like one thing that I talked about was, in rural health, there are a lot of doctors who are still charting on paper. And so that is locked in data, right? There could be something super useful for me, but I can't get to it because it's locked in here. So, AI is beginning to now get to this point where they can read paper charts. So I really think that the industry would be better off and would be well served if they adopted some of these kind of like IDP type, document reading technologies to bridge that gap. And I think you'll start seeing that shift and hopefully organizations can get buy-in from from the other pieces of the organizations to say, we need digital transformation. What we're doing is not scaling, it's not working. We spend more time putting out fires and hot fixing things than we are actually making people's lives better. There are a lot of shifts in you know, solving the interoperability problem. You've got, like I said, the new standards, HL7. The industry is trying its best. I think 5 years might be a little short, but I think in 10 years we're going to see a big shift because these technologies are kind of, if you snooze, you lose, right? We don't want to be left behind as an industry because what we do is so important. What everyone does in this country and all the jobs we do is so important. But when it comes to when your grandma's in the hospital, you want to know that they have the right information, that they're making the right decisions, and that the technology is serving that person, that individual right in front of them. So, I'm really, really excited for the future, and I'm happy and excited to be, at the forefront, even though I'm a small player, to be able to be an example for larger organizations. It's all I can ask for, and to have conversations like this. So I'm super grateful for the opportunity.
Yeah, I mean, thank you so much for coming. But I think one point I wanted to add, based on what conversation I have had with you, is next 5 years, probably after next 5 years, industry shouldn't ask or shouldn't tell about data silo, right? At least this is the base, right? Data silos and data integration into one platform, at least.
Yeah.
So for me,
You have to solve that problem first. That's the one that unlocks everything, right? So
yes. So at least the next 5 years, the organizations will have their own technology or landscape set up where they wouldn't even talk about data silos now because they have the data ready, and we will have much more beyond that in coming 5 years. Okay. So what are the three recommendations you'll give to CIOs of healthcare?
yes, no. So I would say that the first one is to advocate for, you know, the best technology that you can have, the most flexible technology that you can get your hands on. It is it is pretty normal for organizations in healthcare, like we talked about. There's thin labor margins in a lot of them, depending on what sector you're in, to kind of go with a cheaper solution because you need to just meet the financial needs. If you're a growing company, if you plan on growing at all, you really need to fight and advocate for good foundations. I think that is super, super important. And, don't ever stop fighting for it. You may not get it, but please don't ever stop. Your teams need to be excited about the technology they use, or at least indifferent, right?
Yeah.
They need to not hate your system. And I promise you, even if you have something like our Salesforce, people are going to have their gripes with the system. So, having something that you have control over, at least when somebody comes to you with a problem, you can say, let me try. Because I've been at organizations where I was not able to do anything about the state of the technology. We bought that from somebody else. They can't fix it because they have to fix it for everyone in that uses their technology, and we're just a small player in a big pool, right? So having something that's flexible, having something that allows you to solve your problems is critical to meet the needs of your members. When you're from maybe something that I would say when it comes to AI and thinking about how you're going to utilize AI, think about the care first, think about the member first. There was the story about a health plan that decided to use AI technologies to figure out when they should kick people off of their insurance.
Mm.
And when I heard that, I was like, that is a failed premise from the start, right? You shouldn't be thinking and utilizing this technology to save money or, unless it's in service to something else, but to kick people off their services. You should be using AI to say, how do I make people's lives better? When I'm thinking about AI, I want to predict when people are going to go into the hospital, not react when they go in. I don't want to stop the second one. I want to stop the first one. But
Mhm.
really, when you're using these technologies, work with your clinical teams, work with your compliance officers, and make sure that you put the care in healthcare, I guess is what I'm trying to say. Because if you do that, everything will come, right? We've never Jamie, when she started this company, she, dumped her 401k and was convinced that in a year it was all going to be gone. But she had a mission to the members. And when we served our mission, the growth came. And I think that if in healthcare, if you do the right thing, people will see it. They will want to continue to work with you and you will grow. So don't think about the short term, think about the long term. And then the last thing I would say for data teams, if you have a great team of software developers and you put the technology in their hands, like I talked about in the first example, then, steward them and mentor them and really create a culture of mentorship and growth, push them to get their certifications, reward them when they get them, have them come up with their own solutions to problems, teach them the skill set that you have. I was listening to this leader talk and he was saying a good leader should basically develop his team so well that he or she no longer has a job to do. And that's what I strive to do, right? I want to be able to sit in my office and go, gosh, my team is rocking it. I don't have to think about anything. I'm going to quit now. So build that culture. Don't give them bad technology that they have to fight with every day. Give them something that allows them to solve problems, change people's lives, whether that's the end user or the member in the home or the plan, the payers or the customers that we work with. Empower your team to have an impact because when they have that impact, yeah, people want to be paid well, but they're willing to stay and they're willing to work the extra hours because the mission is there and the culture's there. So I say that's three things.
Yeah, I think that's incredible. The 3 points which you have mentioned, and out of all those 3 points, one message which I have understood is think about people first. So whether you are thinking from a patient point of view or you are thinking from a team point of view, right? You have to think about people. So that has touched me personally. And Alex, it has been incredible conversation. Thank you so much for sharing your journey and expertise. I'm pretty sure our listeners are going to find it very insightful. And yeah, thanks again.
Thank you so much. I really appreciate the opportunity.